What?
Something wrong about this.
Not before the surgery.
It's like not before the surgery, right? Yeah. So today's a special case. Well, what's special? Well, today is special, right? Everybody's special. You're special. But I guess you could say I'm especially excited about her nose because it's just a little exaggerated. And so the delta, the change that we're going to get from this procedure is actually pretty significant. It's still going to be a normal, natural nose, but you'd be shocked at what this is going to look like once we reduce this hump and narrow the base and shorten the nose. The distance is like from here to here if you want to think of it that way. So we're going to shorten it a little bit, we're going to rotate a little bit, and we're going to work in a nice tip. So we have all these things kind of going on, but they're actually part and parcel to a lot of the noses that are done nowadays, and make sure that she can breathe and all that kind of stuff. You got to breathe. You have any questions?
Yeah, I just have one. So I know when you like shave this part down, it's gonna like make my nose look different, obviously, but I'll still have like a natural curve to my nose, right? Like right
like
here.
That dip is
The
what
dip,
Yeah.
Like it's not gonna.
You want
change.
that?
Yeah, I mean I like this part. I just don't
Yeah.
like this part.
Well, this part does.
down,
Yeah.
it's gonna not be as
This part doesn't change
I just want
really.
to make sure I just have like a
Normal.
like a good because I don't like the noses that are just straight.
What do
down.
you
Does
want?
that make
You want a little curve?
Not like too much of a curve.
Yeah.
I'm sorry.
She's
Am I
talking
making it?
about this part.
Yeah,
over
like
here.
watch, turn to the side.
Yeah.
Like she has like a good.
Right here.
Does that make sense?
Yours is.
Or no?
When you flatten this part out, you're not going to see that much of a curve like
But
what you're
nothing's
seeing
getting
this
touched
much.
right here.
No, I don't go up there.
Oh,
Yeah.
okay.
Yeah.
Oh well,
Sorry.
heck, it's like she's basically saying, look, I don't want this area of my lawn to be mowed, so I'm like, no problem, we're not there anyway, so we're not there at all. So it's cute
Okay.
though, yeah, it's adorable. And so really that's it. So we're going to show you how this is done, and then hopefully we can do a little markup, which means, this is not for you, but we get the iPad out and we're just going to show you what I'm doing, sort of like, hopefully what we're talking about right now is something that you can relate to, but we have to speak the same language. And so the language is that, the dorsum is this part here, the base of the nose we're talking about is the bottom here, the tip is this region here, and the length of the nose is all this region here, and then the relationship between, let's say, the bottom of the nose and the lip is this area over here. These are your nostrils here, okay? These are your openings, and this is your columella. There you go, Nose 101.
Real quick, I want to bring your attention to something. We really appreciate you guys watching, but 96% of you, 96% are watching these videos regularly and you're not hitting the subscribe button. So please go do that now. When you do that, it helps us grow our community, it helps us get the word out, educate others, and in turn, just help others, okay? So hit the subscribe button and continue watching.
All right, which is really cool about her markup. To me, this is kind of fascinating when you look at people in a picture. If you kind of look at her face, boom, you could see the asymmetries. Her the length here, the angle of her smile, the fact that her midline is off. Her eyes are a little bit different as well, or in kind of different levels. Even her eyebrows are different. This one's higher here than that one over there, and the like. But with regard, so let me just back out of that. With regard to her nose alone, I said her nose is long, and it is, but she also has a long face, so we can't go crazy about that, reducing that. You can see the asymmetry she has here in her nostrils, left to right is totally different. You could see the narrowness, so the narrowness applies this aspect here, this narrowness, and then you can see how it kind of balloons here at the distal, let's say, 50% of her nose here is so much more wide than, let's say, this 50 up here, right? So when I take the dorsum down, okay, what's going to happen is that this will actually get a little bit wider, which is something we look as good. The base of the nose is this area here, down over here, and down over here. That's what I'm calling the base of her nose. So that's the width of her nose. And what I'm saying is that's actually going to appear wider to some degree when I'm working with her nose. So I'm going to have to narrow that a little bit and just infracture the bones just to kind of close this upper part after we take it down. The dorsum, again, is this whole portion here, and we want these to be straighter lines and not so narrow. And then we want the tip, which essentially is from here to here, to be less wide, okay? And so that on a frontal view, the nose will just look more harmonious. Not much I can do for the asymmetries for the alar in this region over here. And it's important for people to kind of accept that, you know, some things you can change, others you really don't have that option, or nothing that's really that effective. All right, so let me change the view. So this is obviously the money shot. The money shot basically means this is where a lot of the change is going to happen. So with our finer pencil here, and let me change the color to this blue again. You can imagine that this hump is this whole area here. So this is this hump that has to go in order to create better balance with her nose, okay? And that's going to be a big part of what we're doing today from the lateral view. This angle here, actually blue is not the way to go. Let's go with yellow. This angle here is 90 degrees. So you could see she's a little more than that. She's probably 92 degrees. But I want to open this angle a little bit to make it more feminine, because this is more of a masculine sort of angle, again, theoretically. So we're going to rotate, if you want to think about, rotate this up a little bit without going crazy, obviously. Now notice what that's also going to do is shorten the nose. So shorten the nose, let's put green here. So think of the distance from here to here. That's the length of the nose. So you can imagine as this rotates like this, it's going to shorten this distance from here to here, and so that her new nose will sort of come up in that kind of way here, right? So that is going to be the shortening effect of the nose, and we're going to get that from probably trimming her septum down here at the bottom of the nose, because by definition, she's what we call, well, it's a descriptive terminology. She's what we call a high tension nose, which means that the septum has grown so much that it just pulls everything out, which also, by the way, makes her nose narrow, as we already know, but it makes her nostrils very long and not flaring, because you can imagine as everything grows this way, it's pulling like a tent pole. It's pulling everything out, and therefore this is not forming this sort of nicer, let's say, relationship, okay, where there's a little bit of a flare over here. You can imagine that the more this pulls up this way, the more we grab this and pull this up, this just becomes just narrower. See, like that, right? It just becomes narrower. And so that's a little funky, and this is a little probably bulbous, but we'll get something in between here that sort of works and is just more ideal. Now, I also noticed that today when I just prepped her that she's blocked pretty significantly internally in terms of her breathing. I've done some things to sort of make that better, but I'm not totally convinced. She may not have a little bit of an issue with the breathing. But, you know, I don't think it'll be worse, but it may not be a lot better. But, you know, maybe it is better. I don't know for sure, but we'll see. Anyway, that's some of the aspects of a rhinoplasty that we're going to work in her case. And it's important for you to kind of understand that so that you could relate to me, you know, what you're seeking in terms of a rhinoplasty. And, you know, we both have to be on the same page in terms of the terminology. Nothing crazy here, but this is going to be a cool nose. So come on in, I'll show you how we do it.
Yeah, go for it.
You know, you can get that boom camera closer if you want, Micah. You know, that can, if that helps you, that can get closer.
I could do it from an angle.
It's just because where the bed is.
Yeah, it's just
Right, it's at the end of the bed.
Blocking it.
Oh, the base.
Yeah.
Okay, whatever, just saying. So what I think is cool about this case is the concept of sort of the changes that can occur in the nose. And so because she's so exaggerated in some ways, I think it's just a good educational nose to learn about the possibilities and the effects of changing one area and the impact on another, and that's what just kind of makes it interesting. I know a lot of folks who watch these videos, I mean, they're really into it. But it's also pretty obvious when they just become very knowledgeable, and it becomes easier for me to be able to relate to the patients when they submit these consultations and they describe what they're looking for and stuff. But which is really cool, you know, they watch my videos when they're looking for, the words they use are like normal, proportional, natural, you know what I mean? That's my lingo. But I guess it resonates with people, so therefore that's cool. I was telling Micah, your videographer, I just got a consult that I showed him actually, and it was how old was she, Micah? She was 17-year-old, yeah. 17-year-old, which raises some concerns because my gut reaction is just maturity, you know, and I kind of understand how life works and how people could make fun of people or whatever, and how people compare with other people. Is that the thing more, like, you know, on the internet or social media and stuff? And what I look for is just signs of immaturity or just not being realistic, you know. And so the girl, the beginning of the statement was all pretty reasonable, but then at the end she used a term that just gets me super nervous. What was the term, Micah?
Button nose.
Button nose, yeah.
Ooh, yeah.
So, and then I saw the picture and I just immediately became very sort of leery of the case, because it's like she is Hispanic and her nose was pretty thick, and a lot of times Hispanics can have thicker skin than other people, and so that just it's sort of like it becomes an impossibility. I can't, you know, make you a button nose because your nose just won't allow me to make a button nose, you know.
Your anatomy that doesn't.
Yeah, your anatomy just limits that. So, you know, I don't want to disappoint anybody, and I don't want them to be unrealistic. So I just kind of wrote her, told her what I thought, and we'll see how she responds. But, you know, the nose is a very important part of your identity, and I don't take that for granted, and I understand my responsibility of sort of making sure that we do the right thing, you know. And sometimes doing the right thing is maybe doing nothing, or just waiting for her to sort of become more realistic, you know, less idealistic. You know, there's not an answer for everything, and, you know, and not everything is possible. And you don't want to just operate for the sake of operating, you know. Don't want to do that. So, I mean, this patient has, you know, pretty normal skin. Sometimes when you have super thin skin, you can actually see the cartilage, the shape of the cartilages with an outline on the skin, which is an extreme case. Most people, you just don't see that outline, and you know what's going on. I know what's going on underneath there because I do noses. But, you know, for most people, they just, you know, the shape of these cartilages is what determines the shape of your tip. It's just that simple. In the case we did yesterday, that was cool, wasn't that, Mar?
Very cool.
Yeah, that was a girl that had...
That was art.
Yeah, very asymmetrical cartilages that were responsible for this like mass we saw on her tip. I knew it had, I mean, she had a history of trauma, so I thought for a second that, you know, it could be scar tissue. But what happened is she had trauma at a young age, and it actually was so significant that it really affected the shape of her cartilages. I actually had to use a graft, which you don't see me use often, because I'm hoping to do a lot of the surgery without grafts, because grafts, although they can be okay, add an element of unpredictability in the nose, and then what happens to these grafts over time and the shape of them and all this kind of stuff. What's the actress that I was talking about that had that tip graft there?
I can't. Sal? No.
What's the actress that has that tip graft that I was talking about the other day? That
She's from Austin.
she's from Austin.
Miss Congeniality?
Yeah,
Sandra Bullock.
yeah, Sandra
Yeah,
Bullock. You know, I watched a movie with her and Knife, and you can just see that tip graft that she had that just has just not done well over the years, and so, you know, adding, I like to sort of work with what I have as opposed to adding to the noses. And then sometimes you have to add to the noses, and I will, and all this kind of stuff. And I like it too. It's kind of fun. But I kind of will oftentimes just suggest you go to someone who feels more inclined or has more experience than I do with that. Which is a way of saying something, but I'm not sure what, but you get it. All right, let me, I was going to take this dorsum down with just the knife in a fell swoop, but I think that I want to leave the option open to table up a bit and knife. Leave the option to use her upper lateral cartilages to my benefit because she has such a narrow nose. I could possibly use them as a graft or a rotation flap, or what we call a contouring flap or a spreader flap. And that's a little bit more detailed than what I'm trying to achieve there, but I'm a little concerned about her breathing and her breathing potential. So with that in mind, I want to keep the options open. Don't burn any bridges. And you folks can comment on these videos, can they, Micah?
Of course.
Yeah, and please do if there's something you want to see, or if you like the mock-up that we've done on her, if that was helpful and educational, let me know, and my peeps will get back to me, and I can do a better job of making the video experience even cooler.
Audrey,
Yeah.
can you grab Dr. C his battery to his light?
You can see it dimming.
Mm-hmm. It dimmed one. Yeah, so go and grab the other one.
Grab it before you take this. Knife. And then there was light.
Little pit stop there.
Mm-hmm. All right. So next step is going to reduce this hump. Then bones come to about here. So let me draw that on her so you guys get an idea. So bone is there, here and here. So all this back here are bones, and this portion up here is the cartilage. So probably 50%, 50-50. Usually there's more cartilage than bone, and it's important to know this issue in general because a short nose may have a short nasal bone, and those can create a problem with support. So I don't want to bore you with all these kind of weird details, but the reason why a lot of people don't do noses is because they can be a little tricky. And since it is the important part of your facial anatomy, you want it done right. And so thankfully a lot of surgeons know not to even go there, you know.
Professor, I need the keys.
So what I'm doing here is just exposing the components of the dorsum, of the roof. Maybe Micah's upper area can get that.
Right here.
Okay, I got this, and then so we're going to do a significant reduction of her the dorsum of the height. Okay, out. So this is already probably 2 millimeters here, and I know I'm going to do more. I remember when I was a kid many years ago in training, and boy, I worked with this world-known guy. Yeah, this world guy. He's good, and he did this with one fell swoop, and I was like, wow, man, that's cool. I'm not as gifted, I guess, but so I'll take it step by step, a little bit until I get to the point where I can take it. So even though I took that down, I think I'm for sure going to take more, but this is all bone here. Look at that. So what I may do is take this bone with a chisel, which is something you probably haven't seen me do often because I don't have to, but it's just significant enough and it's narrow enough that it'll be easier for me to take it down as, oh boy, you know what we got to deal with now. So this would be much better if it didn't have that, right?
Yes.
So that, I'm sure you have a, you have the sharpener that we hate. Yeah, well, it's just a ridiculous tool. Absolutely ridiculous. Oh my God.
It's a small sharpener.
I mean, and it's triangular nonetheless, and the girls are trying to convince me that, oh, this is the only thing available, and I'm like, no, okay? I mean, come on, seriously? So they get it after a while. We tried to use it yesterday, and this thing flipped around like it was,
What is their pitch on how to use it?
I don't know how to use something that's triangular when I'm trying to stabilize it. Now it explains why it flipped around, because it was triangular. Mar didn't tell me it was triangular, but don't get me going. You don't want to get me going.
Yeah, don't get him going.
No.
We love the file.
Yeah. Which is a good point that, you know, a lot goes on in the background, folks. It's not just what you see, okay? You know, a lot of preparation, a lot of, you know, details and, you know, lining up your ducks. That looks pretty good, though. That's nice. Actually, this is a pretty short one. I need a thicker one. Here, I sharpened this and not even what I needed. All right, yeah, that one is much better. Well, the good news is the sharpener actually works. But you know, it's like probably all you mechanical people out there, or the people that cook, you got to have the right tools, right? You got to have the right stuff. The surgeon has to have the right tools. It just makes him or her look really expert, you know? Because when you're sitting there struggling with a wrong tool, it's just like, meh. Things are not the way you want them to be. Let me see. Yeah, that looks nice. All right, so let's go after this. And I can see here where her bone clearly starts.
Can you see that in there?
Right there.
'Cause
Okay,
that, you
go.
can see it.
All right. Go. Oh, good. Go. Nice. Go. Go. Easy. Go. 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 Nice. Go. Whew. All right. That looks pretty good.
It's a big piece.
Yeah.
That's all bone?
Yeah, it's all bone. Suction, sir.
Well,
Again, if we had the right instrument.
Wilson, can you
Suction.
turn the suction on?
Yeah, this has.
And this one, it doesn't have teeth.
Yeah. That's what I asked for in a long time. So I didn't have the right instrument there, and that's why you see me struggling a little bit, but now we got the right instrument, so boom.
Whoa.
So we got that off in pieces instead of, but you can see that, look at that, boom.
Wow.
So now, from the side view, her bone is lower than her septum, so I got to go back and take more of the cartilage. But here, let me show you here in a minute. So that's down at a nice level here, but we still have all this over here we got to take down. So we'll go after that. So you'll never give me that when you have that, right? You're never going to give me the biting instrument when you just had the. Okay, so that'll never happen again. So this is you're seeing a moment when the nurse and the doctor get on the same page in terms of how the future goes, and so that's okay. Nothing wrong with that. So she has a lot of upper cartilage here, so we know she would because she had a lot of stuff. Well, let's suction so I could see better.
Wilson.
Visibility is really not that good. Okay. And let me see this for a second. Do you have a wider one?
Yeah.
She's so big at the. Yeah, that's better. Here we go. Boom. All right. So we got that, and this is probably not going to work because this already hit a bunch of bones. So.
Can I have another 15? Then?
So you're seeing another teaching moment here, but. All right. Let me get this. There's only so much I can do to blame somebody else. Okay, and then this here looks like a little extraneous stuff. Boom. Yeah. Okay, good. That looks good. All right, let's see what that looks like. Okay, so even more betterer. I'm gonna. So you can also see how the width increased. You see this? How the width increased as you take a triangle down. You see how, take this triangle down that I made right here, right? That's a triangle. As you take this top part off of here, it gets wider as you get towards the base. So that's why the nose gets wider, which is really cool. And you can actually see how her ala flare is sort of much more natural now, because as this comes down, it's not pulling everything up, and see that, making it all narrow. See that? Look from the end here if you can, Micah. See, I pull this up, it makes for a narrow nose, wide nose, narrow. So these are the dynamics that I want you to learn about, because it's super cool. It's super cool. All right, so we still have a little bit of cartilage here, but part of that is the, what do you call it? That's upper lateral stuff. So where's the, here, got this. That's better. Hold that tip down. Okay, and hold that. All right, so this is a good picture here, as much as you can kind of sort these things out. So this is her lower lateral cartilages. They're paired. And then this is her upper lateral here, which I did not on purpose remove, and I'm going to reduce a little bit here because it's just so overgrown. I have to. And they're a little long, so I'm gonna have to shorten them as well. Okay, so got all that done. All right, let's see the dorsum. Okay, so that's looking better, right? You think so? A little bit more right here. And then this nose is real long. As you can see, I want to shorten it up, but I can't because the septum is blocking me. It's right here. See it? Right there. See that? So we're gonna take a piece of that out too, and that'll shorten the nose and help me shape it up to the way I want. But I can still feel a little cartilage right there. No, use the other one. Right at the keystone area where the bone meets the. Oh, I see it. Okay, take that tip open a little bit there, shake down, and boom. All right, and then boom. Okay. Voila. Rasp now, and I'm going to rasp because I can feel the edge. See how I drew her bones? I can feel the bones extending right here, more on this side than on this side. So I'm going to smooth them out a little bit. So the chisel that I used there was more of a get the bulk of it out, and now this is about making it smooth and even. So I bet you now that we talked about the button nose, no one will ever submit a consultation about and mention button nose. I don't want a button nose. Just thinking out loud, you know. Don't want a button nose. I just want a good natural nose. Okay, I get it. And well, the way I interpret a button nose is just a smaller nose. Okay. So the width, remember I drew on the computer the width, how it was narrower here, wider here. Well, actually it's wider here and less wide here because this is wider relative to here, right? So, but I still have to make changes. This nose takes up a fair amount of real estate here, the tip I should say, and I'm going to refine that. So what we're going to do first, however, I wonder if we should, yeah, let's see. So now I'm thinking more or less the order of things. You know, should I do A first or B first? Shorten the nose or work on the tip? I think I'm going to work on the tip first. So these cartilages are a bit wide, and we're going to make them shorter, less wide. I guess not shorter, but less wide. You see how the shape of these cartilages is what provides for the shape of the tip. Okay, so we're going to make the cartilage less wide. Okay, so And as a rule of thumb for average noses, it's like, for me, it's like 6 or 7 millimeters in length, and width, I should say. I gotta stop saying length. Let me tell you what they are to begin with. From here across, the width is, wow, 12 to 13 millimeters. And so I'm gonna essentially practically do it in half. So we're gonna get rid of a bunch of that, so the nose has a better shape, less wide. All right, marking pen. So, boom. And like I showed you how her face wasn't symmetrical, the same thing with the cartilages here, oftentimes not symmetrical. And sometimes you don't want to make them symmetrical because the face is asymmetrical. So I think that means there's just some artwork involved in here and experience too. Okay, local. In other words, you just can't, don't expect artificial intelligence to do your nose job. There is an element of artwork that comes with the human condition. I haven't heard about computer-aided nose jobs, have you?
Sounds like a nightmare.
Yeah, that'd take my job away.
I mean, they have those little robot hand extensions for certain surgeries, right?
Yeah, no, robotics is definitely out there. Not really sure. I could see where it probably adds some value, but I can also see where it just sounds good and not really doing much.
What are those the most useful for? Just super small jobs?
Yeah, just technical stuff where, you know, prostate maybe and a few other areas.
Brains? No?
Huh?
Brains?
No,
Brain?
like a
I
neuron.
don't know. Yeah, maybe. Yeah, that's a good call. I don't know. Probably. What do you think, Wilson? What do you think that stuff will come in handy?
It's more abdominal stuff.
Abdominal?
Yeah, neuro, you can get right on it.
When they do like cataract surgeries, that's all robotic, right?
Yeah, that is. Isn't it, James? A computer. Yeah.
If they've got one, they'll use it.
I think that was one of the early,
Yeah, because it's so small, is that why?
well, small,
Like the tools
and
are so
it's hard
small
to
you can
see
really
because
fold
it's clear, you know, I mean, or it's supposed to be clear anyway, the lenses and stuff. It's just hard to get into, and it's something that can be computerized effectively, obviously.
I
Just-
watched one of those surgeries the other day.
Oh, did you?
Fascinating.
Yeah.
I didn't know that they have to like
Okay, so that's the trimming of
break it up.
the width, and then we're going to reshape her tip. It looks like her tip wants to go right here, and we'll use a suture to
Do you think sometimes people are saying button nose when they just mean reshape the
smaller.
tip?
I'm thinking, no, I think it's the whole nose. Just like a small little cutesy kind of thing. You know, a lot of people see people with noses that they like, and they're like, oh, I want a nose like that. You know, well, it doesn't necessarily work that way. You know, it's like, to me, to some degree, it's like, you know, you're 5'9" and you want to be 6'2", and it's like, no, we haven't figured out how to make you tall yet. Well, I don't know what I did here, folks, but I messed that up. Let's try that again. That's the problem when you use loops and all of a sudden everything, your field of vision changes dramatically and you're not seeing everything and you get caught up with stuff that's outside your field here, but right next to you. Okay, so we got that side and I need the other way.
I'm trying to adjust it to me.
Yeah, you're seeing us
I know.
the other way.
Well, let me.
All right,
There we
Mar. There we go. All right, yeah. It's just I'm trying to reverse the stitch, which will be helpful for me, but I don't want to let go of what I have here, so we're trying to do it.
Make a great tailor.
You think so, huh? All right, so that's what we call a dome stitch. The dome is theoretically the highest point of the tip complex here, and I could tell I'm going to have to do a little bit more work, but I also know that this is sort of projecting out. The columella portion here is projecting out larger, more projecting than I want, and I want to, if you will, I just want to kind of improve the angle here, but I can't do that because this is going to be blocked here. So let me do that. Okay, so out here, and more Raytex whenever possible. So you can see a better tip already. Here, let me just show you what we just did. And we're not done, by the way. But the tip is smaller. It's also a little bit more projecting. So look at that. That's a better shape, better tip. That's pretty nice. But the nose is still pretty long, so I want to shorten it up. Table up a bit, sir. Some local. You know, there's a saying that as the tip goes the nose, which basically means that the area behind here is sort of what we consider mundane. Oh, maybe mundane is not the word. It's just not as
1, 2, 3, 4, 5, 6, 7,
artistically impacted as the tip is. So the tip is an area that requires more skill and experience, and therefore and getting the tip right means a lot to the patient, so that's where the saying comes from. All right. So what I'm doing now, which is kind of cool, see right here, this is the edge of the caudal septum, and I'm just going through this membranous septum. Just think of a layer of skin right between both sides here, and with this sweep here I've exposed, Mara's going to help you see that, I've exposed the distal end of this septal, this midline structure, and I'll show you more details here in a minute. You get the cartilage is this white structure here, and septal angle is right here. It's just where the, if you look at an anatomy book, for instance, if you all are home, or actually anatomy book, I'm aging myself. Oof, go to the internet and just look it up. Just remember, I had to go to books for all this stuff, and now you folks have the ability.
Still books, they're just online.
Well, but yeah, call it what you want, but
They're
you
just
can
online books.
literally look at this online and pull it up in 2 seconds, which is just unbelievable. It really is. Golly. Stop using the internet for all the nonsense and use it to educate and learn. You got this in the wrong place, obviously. It's got to be over here. And try to get out of the way.
I know, that's what I'm trying to do. I just don't want to.
Could you see Micah or no?
Oh, I do.
Oh, okay, all right, good. All right, so what we're doing is showing the other side, and it's just super bloody here. I don't think Mars she's struggling. As they say, she's, for whatever reason, I'm not really sure. Maybe you should be using that hand, I would think. Why are you coming around with that hand?
Coming this way.
Well, maybe that's still, but for people trying to see what the heck's going on.
Oh, no. I'm good.
Oh, you good? Okay. Well, I'm not good, so, all right, so, all right, stop, get out. So we're gonna configure this so that we look like we're knowledgeable about this stuff. Blood is always an issue. It gets cloudy. But this is going to be cool. All right, let's start all over again. All right, so here's the septum. Maybe it just needs to go over on this side. Here it is here. You see that, folks? Look at that.
Dr. Wilson.
You see that? That's the caudal septum, this piece here. But you get a wider hook in it. I want people to really see this well. Yeah, come over here, Micah.
Wilson, can you put it back on? Sorry.
So I'm committed, as you can tell, to getting the best video possible for you folks to sort of take a gander. All right, there it is. There she blows. Give me a knife. And this is what's going to shorten the nose. It's pretty long, so I'm going to take a little bit more generous than you typically see me do. This is probably, I don't know, 3 millimeters or so. Oh. There's a lot of attachments here. That's why everything is like pulling teeth. Oh boy. And then there's bone down over in this region, the nasal spine, which sometimes I have to go after as well. But this is firmly attached. Boom. Oh wait. I wonder if it's my what's that? Oh, I think it's my knife. Yeah, just not that. Voila! Hooray! There's a nice chunk. Okay, and so that was at the end here, and when I remove that, it just makes this nose shorter. Okay, so we got that out finally, painstakingly.
Thank you.
And so now I have the columella, and you can actually see this angle is already better because, as you can imagine, as forceps, as this is pushed forward, so to speak, it just has this angle that you could see on that view up over there. But now that that's gone, I'm going to bring this back. I like that angle much better. It's just going to make the tip far more interesting and beautiful. All right, I'm going to take a flare control stitch, which is a stitch that goes right down over here, which just controls the flare of the tip. And it's also a way of narrowing the columella, if that's what you're interested in doing. Sutures also add strength to the cartilages because a lot of what I'm doing right now actually weakens the cartilage. So it's a little bit of a yin yang kind of thing, and sometimes it's like okay to weaken the cartilage because I want them to drop into a more favorable position. And sometimes, let's say someone has a big tip and you want to make the tip smaller, well, you can weaken the cartilage and it'll settle down during the healing phase lower. Whereas a lot of noses you actually want tip projection, which is the opposite, where you need to do more to preserve strength and integrity and get projection and stability, all that kind of stuff. Okay, raise the table up a bit, sir. And now what I'm going to do is just get a better assessment of where we are. Okay, take that out, Mar. How her natural cartilages are in terms of the strength and how that's affecting everything relative to the dorsum that I just made. So, boom. Okay, so that's better, huh?
Yeah.
You think that's better? See, you can see how it's shorter. I don't think I want to lower the tip anymore. The tip will lower it by itself. So I'm going to probably set it right where it's sitting naturally right now. Okay, stitch. And so what I showed you I did is I separated the columella from the tip area here. And now what I want to do is reattach it, if you will, to the septum, and hopefully it'll scar there and make a new home in that area. Okay, so that looks like it's sitting right around there, so I'm going to look for a home here. So a little, I think I need more of that than that. Yeah, there you go. So, woof, what'd you just do?
Just so you don't get
get caught off. All right.
Because you were all tangled.
Felt like, oh yeah, I'm all tangled, as Mar says. I'm all tangled. A lot of tangling going on today. Okay, so I like that stitch there, and then what Mar's going to do is gently. No, you're going up. No, let it go, and just hold it where it is, right there. There you go. Woo-wee. Oh yeah, nice. Ooh. All right. So there's probably multiple things I got out of this stitch. Stability. Okay, out. Stability of the columella tip complex in general, slight rotation and shortening. So a lot of stuff going on at the same time. I know it's confusing, but I think if you look carefully and if Micah does a good job with the video, that you actually could come away saying, oh God, I see that. Yeah, it's kind of cool.
You can come away a surgeon.
Yeah, you too can try this at home. But look at that. Boom. Isn't that cool? Isn't that nice? Mm-hmm. I'm pretty happy. I mean, you know, so when to get out, you know, the tip is still maybe not as small as I want it to be, but my concern, and this is a good point and something that is a comment too to my specialty, is that you have to preserve the lower lateral cartilages because it holds open the nose here so you can breathe. It's just so the idea of putting in these little grafts on the side of the nose just implies that you've reduced so much of the lower lateral cartilages that they don't even have any support anymore. So then you're replacing it with a graft. Makes no sense. Just shape them up the way they need to be. I mean, sorry if the nose isn't quite as narrow as maybe we think we want it, but I think that breathing is important and natural is important, and sometimes less is more. So there's a reason for my madness. I actually like that, and it's always going to be a lot better than what it was. I want to look at her cartilages, see if there's anything I want to do. I could possibly let me try a transdermal stitch. So Micah, if you get it from the top here, and I'm just going to throw this in here just to see what we get.
Because you could undo it if you don't like
Yeah. So you can see sort of this relationship over here and the width, this angle right here. And I'm going to put in a stitch that I want to play with it. And so what I'm going to do is throw this stitch, and if Micah captures this, you'll see as I tighten it up what's going on, and then we can decide whether we like it or not. Okay, so I'm throwing a surgeon's knot, two swings, and so that unified the tip to some degree, and it made it a little bit narrower in terms of this angle. Oh boy, sometimes it just wants to get in the way every time. Okay, and if I don't like the stitch, I can just take it out. But I think I like it, and I think you guys may like it. Leave a little bit more tail on that more. You're doing a good job of like practically getting it on the... Okay, so let's take a look at that. So I'm just squeezing some of the edema out of the nose, and trying to redrape the skin back the way it's supposed to go when I'm done, so you get a better idea what's going on. Well, that helped. That definitely helped. What do you think, Mom?
I think it did help.
Did? Yeah.
Yeah.
That's even
It really
cooler. Yeah. And that's a nice dorsum. I don't know. I mean, I wish I can get a vote,
a live vote.
a live vote, but I don't want to be any more aggressive than that. I think I'm good with that. Slight asymmetry, but nothing crazy. And remember how I showed you her nose was asymmetrical to begin with, and her face was asymmetrical to begin with, so symmetry is not always what you want.
I actually read an article lately that beauty is actually asymmetrical.
Well, everybody's asymmetrical.
I guess
It's just teaching the world that, so that they, they're like, my nose is a little this, my nose, well, so is everybody, and relax.
Like they showed like comparisons of people
Like a real symmetrical face.
super symmetrical face compared to
They look
asymmetrical. They look
strange.
crazy.
They just look very different, not what you would expect.
And like removes.
Okay,
artistic
so I think the last steps are going to be just putting in a stitch on the roof here, and then we're going to fracture these bones. And as they say, Get the flock out of here. So this stitch here is just designed to align the sandwich that makes up the dorsum, the upper lateral cartilage, the septum, and then the mucosa on both sides. So it's 2, 4, 5 pieces of that sandwich, just to stabilize it so that they don't shift in an unfavorable direction during the healing process. Let's irrigate the dorsum.
Okay.
Irrigate the area here a little bit sometimes, just to get out the bone shavings and little spicules and stuff that may exist. Nice. That looks good. There is a forceps. See, we left that little piece of bone in there. See that? Probably wouldn't have made a difference anyway, but that's okay. Okay. All right, so you could see this is wider than this now, and the tip is smaller. We got a nicer tip, and so the pièce de résistance, the last thing we're going to do is fracture the nasal bones. So there we got our markings. We're going to put in a little bit of local because breaking bones is bloody. Could be. We actually do really well with the blood because we use some epinephrine in here. We also use tranexamic acid, which is a
Do you want to sharpen this one?
so oh yeah, Mar. Hang on, I thought we already did.
This was
Oh, that's the yellow one. Oh
yesterday.
yeah, let me do
Yeah.
this. So today, folks, I'm having a fun time sharpening thing. This thing was particularly
That one was super
miserable yesterday, so we had to use a 2 millimeter instead of this 1 millimeter. But it still works, obviously. But yeah, this little sharpening device, I mean, it flipped out, and I think it went down the block or something. But it left the room, as they say, and we had to use another instrument. But this is working nice. It's just the way we have to hold it is kind of crazy, but can be done.
Right here.
Yeah, that looks nice. All right. So essentially the bone is broken in 2 sides, left and the right. All right, go, 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 woo, woo, okay, go, Go. Go. Ooh, you heard that, huh? You hear that, Mar?
Oh yeah.
Go.
It's like a hollow sound.
Yeah, go. Ooh, yeah.
What does that mean?
You're breaking it.
Breaking it, yeah. Ooh. Oh boy. Go.
I love how you're like, what does that mean?
Hit the thing, Mar. Go. 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 Oh yeah. Boom. So you can tell when you're ready because you've done this a few times. Otherwise, it's going to be tricky to know when the bones.
What was the experience like learning to do that?
It's pretty wild, man. Yeah, it's, you know, every surgery is a major deal. So you can imagine when you're just kind of new at it. Or you can imagine trying to learn this on your own. Good luck. Takes a while, to say the least. Okay. Okay. Uh-huh.
Those are some bones.
Yeah, good bones. Go. Oh, yeah, good. Go.
So it was like under the tutelage of someone?
Yeah. Go. 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 Woo! And the problem is there are programs out there that just don't get a lot of exposure to cosmetic surgery. Like they may be good at reconstructive or breast surgery or something, but they may not get a lot of this. Go. So you have to be exposed to this. Go. Or do a fellowship in it or something, I guess. Like I said, you know, go. It's not for the weary. Go. And I think the advice I give the consumers is you have to vet your rhinoplasty people pretty carefully. Easy. Good. Go. Ooh. Go. Go. Oh, nice. That's nice. All right. Because you don't want to be that person. All right. So what I'm going to do now is try to break the nose. Ooh. Ooh. Oh, yeah.
That was a good one.
That broke for sure. Can you clean
I'm
this up?
getting
Yeah.
Spiked my mic.
Spiked my mic. Yeah. Yeah.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
So this is the moment of truth, I guess, if you want to call it. But I've been holding pressure on this just to stop the bleeding that results from all the trauma I just did. Pressure is a great way to achieve hemostasis, and we're going to take this off, and voila. So I'm going to hold more pressure, but that's a good first view. Her tip is pretty swollen, so I'm trying to work with her tip. I could squeeze more of the swelling out of her tip and you get a better idea because it's swollen. Oh yeah. So you ready, Micah? So we're going to squeeze a little bit more of this water out of the tip and give you a better idea. There, much better. See, the tip is much smaller now that I squeezed it. So it's a rebalanced nose. It's a nice straight dorsum going into a nice tip. Smaller nose. It's going to work with her. It's shorter. We've achieved all these objectives. It's pretty cool. And you were there. Nice.
All right, we are 5, almost 6 months post-op rhinoplasty, and I begged her to come back and see us. All of you get busy with your life, and it's hard to get y'all back, but I begged, and she said yes, she would come back. So ta-da! Okay, we were just talking about, hey, what were we talking about in the video? And she said it was basically about, because it's been so long ago, basically about what she wanted with her nose and the changes she wanted to make. And so I will ask, is this what you wanted?
It's perfect.
It's perfect?
Amazing. Everything I wanted, yes.
Good, good. And do you think about it every day? What's it like? How do you adapt to it?
I just like every time I look in the mirror, I just like get that side profile, and it's like different. Like it's like a new me. I love it. Like not super insecure anymore.
Yeah.
Like, it's like my main, like, I love it.
You love it?
Take a side profile.
Yeah, so taking pictures is obviously a big thing for you.
Mhm.
Yeah, because like, here, let's go back here. So, okay, that was your side profile before.
Mm-hmm.
And honestly, let's just go this way. So here we are, if you can see that shot right there. So yeah, it's much straighter, much more refined, and
Looks
less,
natural.
yeah, and it blends in with your face. It fits well.
Yes.
And you know what? I guess I didn't realize it was slightly masculine before.
Yeah.
You know what I mean? It was just too,
It was-
I really notice it there. That's where I feel like I notice it.
Yeah.
But when you came in, it wasn't, it wasn't like I looked at you and thought that. But
Yeah.
now looking at this compared to that, I see how much more feminine
Yes.
you look and your
Yes.
features.
And it's crazy too, because like at work, like it's all my new people, and it's like
Yeah.
they would never know.
They would never know you did
don't know,
anything. Yeah.
So,
Because it doesn't look overdone, and it looks like you could have been born with that nose,
yeah,
right?
super natural,
I
yeah.
think that's Dr. Caridi's claim to fame with rhinoplasties,
Yes.
honestly,
I'm so happy.
is the natural look of it. It's not overly sloped or anything like that. It
my
just,
mom literally was freaking out because I was getting it, and then she's like, "You don't need it." And I'm like, "Yeah, I do."
Yeah.
And then she's like, "I don't want it to like super like,
Done.
Yeah.
You
And
don't
I was
want it
like,
to be
"It's fine."
overdone.
She loves it.
Yeah?
She's like, "It's super."
I feel like
natural."
that's a huge compliment.
Yes.
For your mom to love it.
I know. She's
Yeah.
like, "You still look like you, like your face."
Yeah.
And it's just perfect nose.
Yeah, it is perfect. I can't see one thing about it I would want different.
Yeah. He did perfect. Amazing. Yeah.
Good.
I love it.
And you can breathe, everything's good there?
Yes.
Good. Okay, let's take some photos and we'll get this wrapped up.
Cool.